doing? You're not feeling well? I'm really glad you called me. We're going to take very good care of you, okay? We'll figure out what's wrong, treat your symptoms, not to worry. Yeah, you'd be surprised at how many people I've actually visited this week. There's something going around. So what I'm going to have you do is just go ahead and sit back a little bit. Lay back. There you go. You comfortable? Okay. All right. Well, if it's all right with you, I have brought my new trainee, Lana, with me, and she's learning how to do nursing care. Okay, is that all right with you? Okay. Yeah, it's always better to have two pair of eyes, right? All right. So I'll be having Lana help me in explaining what I'm doing. And all you really need to do is sit back and relax, okay? All right. Okay. All right, go ahead and make yourself comfortable. Okay, so Lana, what we typically do at this point is just take a few notes on our patient's condition. So I first like to observe them and see if there's anything visually out of the ordinary, okay? So we can see just a little bit that our patient has just a little bit of flush cheeks. And we'll examine more thoroughly the eyes, but there might be a little bit of redness there. And we'll see about any swelling, okay? Okay. All right. And, oftentimes I think a lot of people your age, stress, being tired, dehydration, a lot of that can play into it. So not to worry, we're going to figure everything out, okay? Okay, all right. So Lana, the first thing we want to do is make sure we sanitize our hands. Shake this up. Okay, give me your hands. Perfect. Okay, great. Okay, and it's all right if we touch your face so we can assess you? Okay, great, perfect. Okay, so we definitely need to take our client's temperature. Okay, we're going to be using this forehead thermometer, and I like to take the temperature a few times. I've noticed that these readings can vary a little bit, so it helps us to make sure we're being quite accurate. Okay, so just sit back. Okay, let's do a little bit over here. Over here. Okay. Alright. So the highest we noted was 99.7, so maybe very slightly elevated, very low grade fever, but not much. So I feel pretty good about that. How much water have you had to drink today? Yeah, try to make sure you drink a little bit more. It'll probably make you feel better. Alright. Okay. Alright. So we definitely do then want to take our client's blood pressure, make sure everything is in order. So I will need to take your left arm over here. I'm gonna put right here. Is that okay for you? Okay, it's almost done. Just hang tight. It's a little tight. Okay. Alright, take this off now. Alright. Your blood pressure looks great. You're at 120/78. Okay, so now we really need to assess the client. We did note upon arrival that our client had a little bit of redness in the eyes. So I want to make sure we are checking everything properly. Okay. Alright. So I'm going to have you just look straight at me. If you're not sure where to focus, just look right at my nose, okay? Okay. You will see a bright light here. You don't have to look directly into the light. Just look a little bit off to the side to my nose. I need to be examining the whites of your eyes, okay? Okay, here we go. A little bit bright. Okay. Good. Very good. Okay, very good. The other one. Okay, look right at my nose, please. Okay. Okay. If you can open your eyes just a little bit. So, Lana, a couple of things that we're looking for here. Number one, just observing the cornea itself. And then we also want to make sure that we're looking for that dilation, okay? So, as we look at her left eye here. Okay, just look at my nose. Yeah, you can see a little bit of redness there. Just a bit. Let's look at this one. Okay. Yeah, so overall, pretty good. A bit of redness, and this can really just be a sign of any type of virus. Okay, now I'm going to want to take a look at the sinus cavity here, right around in here. We're going to be looking at the sinus cavity all around here, testing for any kind of sensitivity, inflammation, things like that, okay? Okay, so we're going to just tap along the forehead just a bit. See if there's any inflammation. Okay. Then we'll go to the cheekbones. Is there any sensitivity? Okay. Let's come over this side. along your nose. Is that basically okay? Okay. So, what I can tell is that there is some congestion right here, right under the eyes right here. Are you experiencing any pain right here? A little bit? Yeah. Okay. All right. So, one thing we can do is kind of massage this part of her sinus cavity. So we can try to work at flushing any of the congestion kind of down. Okay? So sit back. Do let me know if this is causing you any pain, but I don't think it should. Okay. Okay, so we're going to start right here. Kind of just very gently rubbing the sinus cavity is right here. Trying to help flush out anything that might be in there. And then we'll even come around down here to the neck area. We really want to get those lymph nodes draining so that there's no swelling or anything like that. Okay. I'm going to go back a little bit farther next to where your ears are. Up toward your temples. Yeah, just stay as still as you can, okay? Make sure to get this all worked out. Okay, we're gonna come around down back to your neck a little bit, under your chin. Yeah, so we really want to get this part, you can see it's a little bit inflamed right here. We want to get this part all massaged out. Okay. A little bit on this side, not as much. Okay. Alright. Okay. Let's see. So theoretically, it should be a little less sensitive when we go around and tap the sinus cavity here. Okay. Alright. Okay. Very good. Alright. So what I think we're going to do is we have a little bit of this mixture that is a proprietary herbal blend, and this is really going to help with opening up your sinuses, okay? So I'm just going to put a little bit on my fingers. Really good. We're just going to start to kind of rub it a little bit behind your ears, okay? Okay, definitely want to get it over here. Yeah. Okay. Let's go over in this help open everything up just a bit. All right. Okay. So then I love to make notes on everything we've done so far. So we have checked the eyes, massaged the nasal cavities, okay, we have added the tincture and assessed the eyes. Okay. Right. Perfect. Okay. How are you feeling now? Okay. Good. Okay. Interesting. So you have a sore throat? Okay. Let's definitely take a look at that. How many days does your throat hurt? Okay. All right. Just gonna briefly take a quick look. You can say "ah" for me. Okay. So it does look a little bit red in the back. Luckily, it's not anything like strep. I think it's just the congestion that we were, talking about earlier, kind of coming down. So on a scale of 1 to 10, how painful is it for you? Is that making it difficult to sleep? Oh, I can imagine. Okay. So, Lana, this is a perfect opportunity to provide a little bit of relief to the client here on site. All right. So, we actually have, this is a oral solution of lidocaine, and it's really wonderful for sore throats. Okay. What it's going to do is just numb the inside of your throat where it's sore temporarily. Okay. And I cannot apply this for you, but this should make it a little bit easier for you to sleep. Are you waking up during the night because your throat hurts? Yeah, that doesn't sound fun. Alright, that's okay. So, I'm going to do this. Okay, then we have a little Q-tip here. So, I should have shaken this up a little bit. Just put a little bit of this on here. Okay. And all you really need is a very small amount. Okay. So I'm just going to put this, just swab it around a little bit, okay? All right. So can you open your mouth for me? Okay. Okay, perfect. Very good. Get it kind of around in the back. Yeah, just tickles a little bit. Okay, we get it kind of under your tongue, in the back here, on the sides. It's gonna make you feel so much better, honestly. Okay, swallow for me. Okay, is it starting to work already? Okay, open. Yeah, this works very quickly. It really makes things just so much more comfortable. Mm-hmm. Yeah. Yeah, you'll be able to apply this to yourself if you need it a little bit later. Mm-hmm. I think that's going to make your sleeping time tonight go a lot better for you, okay? All right. So you're feeling all right? Comfortable? Okay. All right. Well, I'm going to take a look in your ears now. Just make sure everything looks good there, okay? All right. So, Lana, what we'll do is we're going to start with her right ear. So we'll just come around and look over here. Just very gently. And your left ear. All right. Maybe just a little bit of earwax, but nothing too bad. Okay, so I like to wait until we've been with my patients for a little while so they can have an opportunity to really calm down and get their nerves settled, okay? And now I want to listen to her heart and her breathing, okay? Sometimes the pulse can be a little bit increased if we just jump right in and do it, okay? All right. Okay. So, first we're going to listen to your heart. Okay. Can you take a big, deep breath in for me? Okay, very good. Now we're going to go around back. Okay, can you take a big deep breath in for me? Okay. Okay, good. Over here a little bit. Okay, big deep breath in. Right. So the lungs do sound clear, so nothing to worry about there. Okay. Fantastic. Okay. So I do want to check and assess her cognition just a little bit, her visual integrity. So, let's do a couple of vision tests. Okay. So I'm going to have you follow the light with your eyes, okay? So you're not going to look at my nose, you will follow the light with your eyes this time, okay? Here we go. Okay. Very good. Okay. Mm-hmm. Very good. Okay. From a little bit of a farther depth. Mm-hmm. Okay, very good. Okay, I'm going to cover your right eye now. Okay, is that okay for you? Okay. Can you tell me how many fingers I'm holding up? Very good. Okay. Great. Wonderful. Okay, we're going to cover your left eye now. Okay, can you tell me how many fingers I'm holding up? Mm-hmm. Mm-hmm. Okay, very good. So I don't suspect a concussion or anything like that, but I would like to look at the scalp just a little bit. I've noticed a little bit of redness and irritation right up here. And not that that would be causing the congestion or anything like that, but it could be a sign of some dehydration and something that we can potentially treat. Okay, so we're just going to part the scalp here and let's look here. So yeah, Lana, if you notice, like right here, there's just a little tiny bit of dryness and redness, inflammation perhaps. Nothing terrible. Let's take a look over here. Yeah, I mean, since we're here, we may as well treat that since we can. Okay, perfect. So I think what we'll do is give you a treatment for your scalp. And then otherwise, you really just need to have more water intake, increase your water intake, and maybe some decongestants just for a little bit. And then you should be feeling better in a few days, okay? Get a lot of rest. And vegetable soup usually helps too. Alright. We'll come back and see you in a couple of days. Do you have any questions for me? Okay. Yeah, I expect you'll be feeling quite a bit better here soon.